Welcome to the Witness History podcast from the BBC World Service. We are taking you back to the Democratic Republic of the Congo in the 1970s, then known as Zaire. Around 300 people died during the first documented outbreak of Ebola virus. In 2009, Claire Bose spoke to Dr. Jean-Jacques Miembe and Dr. David Heyman, who worked to bring the outbreak under control.
It's 1976, and at a small Belgian missionary hospital in a village in northern Zaire, people are dying from an unknown disease with horrific symptoms.
The affliction is characterised by a high temperature around 39 degrees centigrade, frequent vomiting of black digested blood, but of red blood in a few cases, diarrheal emissions initially sprinkled with blood, with only red blood near death, prostration with heaviness in the joints, rapid evolution towards death after a period of about 3 days.
This first medical report inspired the Ministry of Health to send Dr. Jean-Jacques Miembe, a professor of microbiology at the University of Zaire, to the village of Yambuku. He arrived at the hospital at night. There was nobody there. Most of the staff and the patients had either fled or died.
No patient in the hospital except one young patient with the symptom of the disease. So we spent the night there, and in the morning I went to a house there and I saw one of the nurses was dead, and so I took some biopsies, and after that, when people heard that the physician from the central government from Kinshasa arrived in the mission with medicine and so on, they started to come to the hospital. And so it was a lot of patients coming in the hospital.
So a huge number of patients lining up, waiting to see you. What equipment did you have?
At that time, we have no gloves, and we have no protecting equipment. So we work with naked hand, and all I had at that time was a soap and water to wash hand, because of my hands were spotted with blood, yes, with blood.
By the afternoon of his first day in Yambuku village, a couple of Belgian nurses who'd been working with him were sickening badly. Barely 24 hours after he'd arrived, he was back on the road taking the nurses with him hundreds of miles to the capital, Kinshasa, for a proper diagnosis.
Blood was collected from the sister and sent to Institute of Tropical Medicine in Belgium, where the virus, the Ebola virus, was isolated for the first time.
Ebola, named after the river close to Yambuku. Panic-stricken, the government of Zaire called on the Centre for Disease Control in the United States for help. Dr. David Heyman, a newly qualified epidemiologist, volunteered to go. But before heading out to Africa, he and the team went to Houston, Texas, to the NASA Space Center.
This was a new disease and no one knew what its potential really was, but we knew it was a very lethal virus. It had already killed at least 90 people, we believed, in sub-Saharan Africa. And so we wanted to be sure that if one of our team became ill, we could be evacuated back to the U.S. or at least to Europe for medical care. So I went with a group of 3 other epidemiologists from CDC to take a look at the isolation trailer that had been used when astronauts came back from the moon. After they were removed from the space capsule, they were placed in isolation so that if they were carrying any unusual organisms, they would be trapped within inside. We decided that this would also be useful for our purposes because it could be loaded on an airplane and travel anywhere in the world.
What was the buzz? What were people talking about, and what were you feeling about this mission?
The first thing we were feeling was that this is a very serious disease and we must stop it. We must make sure that we can save as many lives as possible. And the second feeling was one of that high that everyone has when there's something exciting. And we were very excited about dealing with something new, something previously unknown. We had seen what the virus looked like under the electron microscope, and now we wanted to see what it was doing in the field.
Travelling by plane and by car, it took the team a week before they finally arrived at the village of Yambuku and came face to face with the havoc wreaked by the new virus.
Well, in the village it was clear that there had been something going on because the graveyard was full of new graves. The hospital was closed, and we were taken to a house that was owned by the missionaries, and the missionaries were in a very difficult situation because 5 of their number had died in this outbreak. So it was a very sobering time.
At this point, were people still falling sick, or what exactly had happened in the village?
By the time we got to the village, the hospital had been closed because most of the nursing staff had either died from close contact and infection by people who were sick or fled from the village. So the hospital was closed and the outbreak had actually stopped because of that. But there were some survivors, and we identified those survivors. And we were very cautious and very careful with those survivors because it was known that similar viruses could continue to spread from people who had an infection for up to 6 months afterwards. There were actually 13 people who had recovered, and we immediately put them on what's called plasmapheresis in order that we could take the part of their blood that would protect against future infections, the antibodies, and provide them to others should there be a further outbreak, in the hopes that those antibodies would stop the disease from killing more people.
Back in the capital, Kinshasa, the 2 Belgian nurses that Dr. Muyembe had brought with him had died. It was now his job to trace everyone they'd been in contact with between Yambuku and Kinshasa, more than 100 people.
It was panic because Kinshasa is a big city with more or less 6 million people. So it was very complicated to trace the contact and to keep them in the isolation ward in the hospital of Ngalema in Kinshasa. So it was a big problem.
But one of the closest contacts was not hard to trace.
That was the worst day for me because I was afraid, and I started to take temperature in the morning, in the afternoon, and also at house, in my house. My room, I was isolated in a room in my home there.
You must have been very frightened, and did you have family around? What did you do?
So I am alone there. So I cannot be with my family, with my wife. So I was alone there, so waiting for the worst.
And how long did you wait for?
More or less 21 days. 21 days.
Luckily for him, he didn't develop Ebola. Everyone who'd come into contact with the nurses survived. The panic was over. The Ebola virus seemed to have died away.
For me, it was a very good experience, and for me, it is my job. It is my job. It is a good experience.
Because you could help people?
Yes, I could help people. I am in the service of people. It is why I went to Europe to learn and come back. So I feel that I am useful for my people here in DRC and in Africa. Yeah, that is the essential of my life, I think. Yes.
This is a real service that you did for your country because you put your life in danger.
Yes. But it is important to be in the service of others. It is very important.
Nearly 19 years later, Dr. Muyembe and Dr. Heyman were again called upon to help when the Democratic Republic of Congo was hit by a second outbreak of Ebola. It continues to appear sporadically across Africa, and it's still impossible to know when it will strike and where.
Claire Bowes was speaking to Dr. Jean-Jacques Muyembe and Dr. David Heyman for the Witness History podcast from the BBC World Service. The most recent outbreak of Ebola in the Democratic Republic of the Congo was in August 2022. It only lasted 5 weeks. The Ministry of Health declared the end of the Ebola virus outbreak in September of that year. If you've enjoyed listening, why not leave us a review? And please share it with anyone you think would like to hear it. It really helps us in letting people know about the amazing stories people tell us on Witness History. Thank you. Goodbye.
From the brilliant and bizarre.
It was really surreal. It was a surreal kind of atmosphere there. You couldn't really see anybody.
To the shocking and unexpected.
I'm just wondering, what are we going to do now? This was really my worst fear. He found 100% horse meat that was labelled as beef.
Witness the stories that have shaped our world. told by the people who were there.
When he went to the factory, the poodle went in front of him. So the workers only, oh, the boss is here.
Many people had many things to lose by our victory. The future was not so bright.
Witness history.
We had a designer. He brought in a fully storyboarded idea about how the Queen would arrive by jumping out of a helicopter. And we all said, that's brilliant, but it's never going to happen.
Witness history at bbcworldservice.com/witness history or wherever you get your podcasts.